today, we're talking about the impact that it has on this community, the impact it has on our friends and neighbors. This is something that affects, people who live here. Disproportionate number of people who use that facility are Medicaid recipients, Medicaid eligible facilities. Where do they go? We've heard from NYU and Bellevue that if the Mount Sinai system was closed at the Beth Israel campus, they are going to be overwhelmed. They are not going to be able to keep up with the needs, the cardiac needs, the emergency rooms, the various needs. So not only are we first underserving this community by potentially closing, what we're doing, we're taxing our public health system out of Bellevue, and those are real problems. And this assessment and these facts that we found from hundreds of people from our community, from this neighborhood, from my district and beyond, is saying this will have a critical negative impact. So it's our responsibility today to stand up and release this data and to make sure the State Department of Health knows about it and to ensure that they want to allow this facility to close. To just be clear, the State Department of Health will decide whether this can close or not. They can say no. So we need to make sure there's enough data and information before the State Department of Health to ensure that we keep that Mount Sinai Beth Israel open to serve the needs of this community.
And I really want these voices to be heard at the very highest level of government. So myself and Assemblymember Epstein and all of the other electeds, what we've been doing is taking these stories and talking to the Department of Health and talking to the governor and saying, you need to hear these voices, because anything short of not doing that is a deep disservice and insult to this community.